September is Cancer Awareness Month, and that's all types of cancers. This afternoon, we have Dr. John Nemunaitis with us with the Toledo Clinic, Taylor Family Research Foundation. Doctor, why is it so important that we take this month and we really dedicate it to cancer awareness?
Well, I think it's important for people to realize how cancer is, how it affects our society, but more importantly, there's opportunity for therapeutics that can impact cancer. New things are being developed every day. And it's really important for patients to realize this, to seek help, to have hope. Really, there are really good, new and important things developing for cancer treatment today.
See what might be out there for them, which avenues might be available.
Absolutely, absolutely. We've learned with the cancer how it operates, using molecular biology to understand this, and we've learned how to impact those genes, those gene mutations that cause cancer, and that's sort of the new approach that therapy is taking now, that the FDA is approving many new approaches, and it's very exciting for me working in that field to see that happening, to see patients benefiting from it.
Yeah, we were just chatting. You've been doing this for about 40 years, you said. So
yeah.
About 20 years ago, things really started to take a new direction, huh?
Huge. When the human genome was sequenced and we understand what the normal gene structure was of normal cells, we then could define what are the abnormal genes that we could target to impact cancer. And these therapies then just impact the cancer cells and don't affect the normal cells, which is a huge advantage that now the FDA understands it. Many oncologists are working with it, and it's developing more and more treatments, by the day.
And we love to see, the prognoses, get better, and have better outcomes there. So the Toledo Clinic actually opened a beautiful cancer center somewhat recently in Maumee, right?
Yeah, it's just a year ago, and they're great oncologists. Many of my friends are oncologists there, and they had such a volume of patients to manage. They're coming because they do a good job. They're very involved in this field. They're very involved in checking the genetic patterns of patients. And so they felt it was needed to build a center that's very efficient, very easy for our research program to operate very successfully there. It has the laboratories, the radiation imaging, everything all in one space, and it's a great area. So I love the cancer center there.
So people, patients can come in, maybe get, their treatments, but also, get scans, get
everything is all one stop, one shop.
That's wonderful. And we mentioned the Taylor Research, is it Foundation?
Yes.
And that's, you work a whole lot with that. Talk about what you've been able to do with that.
Yeah, well, Steve Taylor, who donated the money, the major portion of it to get this program going, you got to give him great accommodation. His wife had cancer. Yeah. He was very frustrated that she had to travel outside of Toledo sometimes for care. And now the robust therapies that are being used nationally, we're bringing into Toledo. And we're operating these therapies, they're called precision therapies, at the brand new cancer center there.
Precision therapies, tell me a little bit more about that.
Yeah, so the genes that have been identified to cause cancer, RAS would be an example, there are other examples. There are now therapies that can block just those genes, the abnormal genes that aren't in normal cells. And we have access to those therapies that are developing, that are utilized, and bring them for these patients through a clinical trial.
And as you said, here, not, some big city, hours away, or, this is happening here. Yeah,
the Toledo Clinic oncologists saw over 11,000 active patients in 2023. And to have access now to the technologies that are literally, some of these therapies MD Anderson won't even have access to, so that the therapies nationally that are offered there, they can come into. I have a long background. I've published over 500 papers and 32,000 citations so around the world. So I've been able to bring these things to the Taylor Cancer Center, and it's something that I think our patients in Toledo will have a big benefit from.
Yeah, well, we're happy to have you here in the area. So if people are at home and they, hey, I didn't know all of this existed, they need to get some more information, where's a good place for them to go?
Yeah, just the general information number. We have the research piece of that. We have the website that's involved as well, and so those contacts would be important for the patient to call.
Wonderful. And it seems like with this research ahead, we could have a bright future. Hopefully, right?
Yeah, it's never give up hope, but even more so now with these technologies, a lot of them look very promising. It's very exciting. Our first patient, in fact, had a great response.
Oh, wonderful.
Yeah.
So we'll look forward to seeing more of those successes. Thank you so much for being here today.
Thank you
appreciate it.
very much.
Yep.